Hello and welcome to the Stone King E3M 2023 Procurement Act Unlocking the Art of the Possible webinar. My name is Jonathan Bland. I'm the Managing Director of Social Business International and lead the E3M initiative. And we're really proud to partner with Stone King on all of our work with E3M, and really excited to be with you today. We are going to be looking at some of the issues that are needed around unlocking the art of the possible when it comes to looking at procurement. We're going to be looking at some of the myths that are there and how people can really use the flexibilities that exist to support collaborative commissioning and to kind of harness the power of social investment and partnerships, with a real focus on system stewardship. I'd like to start by introducing our kind of two experts that we've got with us today. Julian Blake and Sandra King of Stone King. So if I start with you, Julian, if you'd just like to say who you are and a little bit about what you do.
Thank you very much, Jonathan. Sandra Hamilton of Stone King. I'm Julian Blake. I'm a public benefit lawyer. I've been a public benefit lawyer for 35 years and have come to see public services commissioning as the most important public benefit issue.
And Sandra.
Hi, it's an absolute pleasure to be here with Jonathan Bland, and we're working with Julian Blake at Stone King. By way of a little bit of an introduction to my background, I first came across the idea of procurement being a social policy mechanism in 2003, and that was in Canada during the bid for the Vancouver Olympic Games. Prior to that, I really didn't know about the power of procurement or how valuation practice could really have such impact. And so by the time we finished putting on the games in 2010, I had really seen how even something as simple as a flower contract could change the lives of women working coming out of the transition house, women facing domestic violence. So I started to really ask governments, why don't we do this more often? And I've been running demonstration projects in Canada for many years, formed an executive MBA in social enterprise leadership. And then 5 years ago, I returned to the UK and I conducted research into how do public managers respond to mandatory social value policies. And that's work has led me to ultimately doing this work with yourself, Jonathan, and with Julian at Stone King. So we're going to talk a little bit about how that work relates. Pleasure to be.
That's great, thank you. And just to let everyone know who's on the webinar, a couple of things about how things work. I'm going to be asking a couple of questions to Julian and to Sandra, and then in relation to their replies or your kind of interest more generally, please do use the Q&A section to put in your questions, and we'll then have a bit after Julian and Sandra have finished talking where we can hopefully answer some of those questions. And if we don't get around to all of them, then we'll try and follow up afterwards, because I know there's a lot of you out there today. We are recording the session as well, so that will be available for you, and if you want to kind of share it with colleagues afterwards. And we'll also be sending you something for you to give us your feedback, because we're always trying to make these webinars as useful as they possibly can be. So broadly, that's how things are going to work. And so I'm going to move straight on now to ask Julian really to give us your opinion. How significant, how important is this new Procurement Act?
Okay, thank you, Jonathan. Well, generally, it's very significant for three reasons. One, it's all about regulating £400 billion worth of public expenditure. Couldn't be more important than that. Secondly, more directly, it puts a greatly needed focus on procurement in relation to its purpose and in relation to its process and how they relate, how they interrelate. And thirdly, through that focus, rather more than the legal provisions themselves, it provides opportunities for change. Now, that focus is extremely important for public services and for the VCSE sector, because transformation is required in public service commissioning, and that's a pretty widespread recognition. That transformation is fundamentally important to public policy, because public policy, obviously, but specifically because public services constitute public spending of 139 billion, and very specifically because 75% of local authority expenditure is in human public services, adults and children's public services, and that's a growing percentage. There is a huge procurement problem when it comes to public services, and that is that the same commercialized, marketized, transactional system is used for human social services in the way, and also used for the buying of defense equipment, IT systems, and office furniture. So it's a system that's covering very different areas and is biased in favor of commercial purchasing when that's not really the way to think of public services. Transformation is required for the VCSE sector, large and small, because they are treated as commercial market providers, when that's not what they are. They're not treated as being dedicated by legal definition as they are to public benefit purpose. And they're not therefore engaging with public authorities in that way, in that purpose-aligned way. This means there's a great distinctiveness to the VCSE sector and that purpose alignment that isn't being recognised and isn't being exploited. The levels of commitment to purpose, the community engagement, the expertise, the service intelligence that's available through VCSE engagement and consultation, all being systemically missed when we're focusing on commercial procurement as the only way of engaging with public services. Public sector representatives will say, yes, but the VCSE sector have organisations that aren't particularly good. Well, that's true in some cases, but in very many excellent cases, VCSE organisations are thwarted in what they're trying to do by the commercialised process, and in others, they succeed despite the procurement system, not because of it. There are some features of the Procurement Act which we should highlight in substantive terms, because they are relevant to public service transformation and to the role of the VCSE sector. And I'm saying in substantive terms because quite a lot of the focus in relation to the Procurement Act has been on the procedural aspects. For example, the increased transparency that comes from notices and things like that. I think from a public service perspective, we should be focusing on the really substantive matters. The first of those is that the government introduced this act on the basis that it would be increasing flexibilities, and we really must hold on to that. Actually, the previous regime had a lot of flexibility built into it as well, including social focus, but a lot of those flexibilities were not being used because of the risk-averse conservative way in which interpretation and application was applied. So flexibilities is a massive issue, and we must hold to the idea that the new act is increasing flexibilities, therefore it's not reducing flexibilities we already had, and it seems to be, and we should assume that it's adding to those. One of the big flexibilities that was not used, the biggest in relation to public services, was the light touch regime, which basically said under the previous regime that there is hardly any prescriptive provision in relation to procurement at all. There is an obligation in relation to publicity, but apart from that, process itself was free in the discretion of public service commissioners. And that was not recognised as much as it absolutely should have been. And we do have the retention of the light touch regime under the new regime, although it was missing from the Procurement Act when it was first published as a bill. And it was the consultation, I think, that really brought the light touch regime back into focus. It's the only place in a previous regime and the new regime where you can tell that there is a difference between purchasing IT systems and commissioning human services. The public benefit objective is a hugely important addition to the Procurement Act because it really brings into focus the reality that procurement is used as a means of securing best value public services, even though its origin is as competition law and in relation to the regulation of competitive markets. Pre-engagement activity has been emphasised, which is a very good thing. Procurement should start with consultation and engagement and investigating actual need and the actual capability of service providers. So that's a positive. Quite widely recognised, there's a new focus on making sure that small businesses and VCSEs are not discriminated against by disproportionate impractical processes. And that's important, and we should focus on that too. And there's also a welcome reference to user choice being a relevant factor in procurement. The Act itself, the provisions of the Act themselves, is not that significant in relation to transformation of public services, really because it carries forward the same commercialised, marketised, transactional system, ideology, atmosphere and assumptions that we've been very used to in the risk-averse system up to date. And really the Act was to quite a significant extent a post-Brexit replacement for EU-derived provisions with changed language, deliberately changed language. The big thing for from the public service perspective is the Procurement Act failed to introduce a new clear differentiation between the stewardship function of public service commissioning and pure commercial market purchasing. I think there's a concern that the Act, when implemented, will not change endemic risk aversion and process-driven approaches and focus more on the public value benefit objective than we would hope and than the flexibilities would suggest. I say that because we've seen many efforts to make procurement more flexible and more facilitative and more purposive, but it hasn't happened systemically. And also because there's been quite a widespread reaction to the Act among lawyers, which is taking rather a legalistic approach, new rules, new regulations, new limitations, new uncertainty, more cause for caution, and all that suggests less likelihood of engagement with flexibilities. So that's a concern, and it takes us back to needing to keep the focus on flexibility. However, there's a very good piece of news. The new government postponed the Act's implementation to very beneficial effect, because what they were focusing on then was bringing in the new, the National Procurement Policy Statement, to which all commissioning authorities must have attention, and the Social Value Procurement Notice, which refines the idea of social value, or the way we thought of social value up to this point, as an additional thing, and focuses much more on social value as an inherent aspect of public services. These two elements were introduced through the engagement of Minister Gould, who was the former leader of Camden Council, and Camden Council was previously involved in mission-driven procurement. And a lot of that mission-driven thinking has been carried into the National Public Policy Procurement Statement and the Social Value Notice. This links in a very welcome way to the macroeconomic, the reformist transforming macroeconomics of Mariana Mazzucato, with mission-driven public value being the determinant of public policy. And the next thing to say there is that those two documents introduce a lot of the progressive concepts that have been talked about for quite a long time, but haven't found themselves into procurement activity and language. So, for example, mission-driven, enabling not buying, stewardship, collaboration, value for money in the broadest sense, not just the financial sense, and inherent social value, not just additional social value. It references the role of social enterprise, and it very importantly references the idea of co-design with communities as a very important aspect of procurement, or rather commissioning and procurement. So this all opens the way for things that we have been discussing for a very long time, including for about 12 years in E3M, within the context of insufficient funding and lack of time, things like moving from process to purpose drivers, moving from competition to collaboration, moving from presumed knowledge to the interrogation of actual need, moving from prescription to co-design and flexibility, moving from standard to mutual contracts, moving from contracts to grants, moving from routine approaches to the recognition of complexity, moving from siloed services to integrated services, moving from direct, acute engagement to preventative action, moving from additional to inherent social value, as I've said, and moving from public value, moving towards the idea of public value imperatives as a concept, really focusing on what is the real need within a public service commissioning exercise. We need to see providers who are genuinely dedicated to the purpose, for example, VCSE providers, but not exclusively VCSE providers. We need to see people engaged in services who are genuinely committed to them, energetically committed to them, not always the case. We need to see commitment to collaboration. We need to see commitment ultimately really to everyone focusing on the available resource, everybody focusing on how the resource can best be applied. So ultimately moving in the direction of open book commissioning for public services. Back to you, John.
Thank you very much, Julian. I'd like to move over to Sandra now. Sandra, both you and Julian were involved in those Cabinet Office consultations that Julian just mentioned that were shaping that revised national policy procurement policy statement. Were you actually heard in that process?
Absolutely, we've been heard. There's been some changes in language that we can see in the National Procurement Policy Statement, that we can see in the social value model. We see collaboration, the word collaboration is being used. We see stewardship, and we see social enterprises being specifically named. The National Public Policy Statement, Procurement Policy Statement, its purpose is very much about making the systems work for working people in this country. But particularly the language I like is making sure the public sector is committed to growing the economy and empowering communities with innovation and opportunity. Well, innovation and opportunity, excuse me, won't happen if we keep doing the same thing over and over again. So we have full permission, we have greater empowering regulation than I've seen anywhere else in the world to absolutely use and leverage procurement as a social policy mechanism. We have 8 clearly defined policy priorities in the PPN 02 new social value model. And there is absolutely clear now, if it's not been clear before, that you will not be able to deliver good social value without engaging with the communities, without speaking to the voluntary community, social enterprises who are working closest with people facing disadvantage. And so I think the idea that market purchasing can be more socially responsible is deeply embedded. But also when we get to the system stewardship, and we really need to distinguish between market purchasing, competitive market purchasing of goods, coming off a factory production line, or where there is absolutely markets for insurance, finance, and then the delivery of complex human services where we need collaborative system stewardship and much more partnership working with the voluntary community social enterprise sector, whereas currently we still have got that master-servant relationship where contracts are imposed. And, we really need to be seeing contracts should be mutually beneficial. Both sides should be involved in negotiating them. We're likely to get better outcomes if we can get more dialogue going. And that applies to market purchasing and negotiated procedures, the flexibilities that we're seeing there, that it absolutely applies more than ever if we want to transform how we deliver public services. One thing I'd like to say here is sometimes it's not procurement at all. And we see that in our demonstration projects where people are inappropriately applying public contract regulations to things that should never be public procurement. So, is there a profit involved? Is it, in fact, between 2 public actors? Is it a public to public agreement? It's not subject to public contract regulations, grants, joint ventures, social ventures, all of these things. We have many, many collaborative pathways we can use. And if we're going to maximize those flexibilities, we need to be trying to do new things with that test and learn culture that's being encouraged.
Thank you, Sandra. And can you tell us a bit more about your research? I know you've been doing a lot of work on this, about your research findings that revealed how social value is interpreted, how it strongly influences the sort of management practice that goes on.
Yeah, so when I came back from Canada, I joined Manchester Institute of Innovation Research, and I conducted my research in Greater Manchester. And it's a region that's, I think, widely recognized for being particularly progressive in this area. And so I interviewed public managers and the influences of public managers on how would they respond to mandatory, or how were they responding to mandatory social value procurement, which had been in place in Greater Manchester longer than anywhere else, probably since little after the financial crisis, 2008, really spurred the change in the Greater Manchester area. And I think people probably are aware that there's up to 30% social value weightings in some local authorities in the Greater Manchester area. So it's a significant weighting, and people need to get really good at it. And what I found was there was really two interpretations of social value that strongly affected the processes that were chosen. And the most transformative actors really understood social value as a mindset. So this was embedded organization-wide, if not system-wide, and it would involve a fundamental shift in how value is defined, that wider understanding of value beyond price, because so much of what we're doing in the non-profit sector, I hate being defined by what we're not, but it clearly is not about profit. It's not a commercial entity. So what we really need there is to have system stewardship of priceless things that are really hard to price. So priceless procurement is one of the things that actually did come out of this research. And I think the most transformative actors thought about social value in recruitment. They thought about where they were recruiting, where people were coming from, how many people worked in a hospital, lived in the neighborhood of the hospital, or were they traveling from further away? They thought about in planning in local councils. They thought about it in finance and in budgeting. So it was deeply embedded. But the more transitioning actors it was less of in the DNA of the organization, and it immediately began to be an add-on at the end of a procurement process. And that add-on at the end of a procurement process may be appropriate for market purchasing. If you're strategic and you know what good looks like, I think we can steer the market and give market signals to what we want to foster and reward. But in system stewardship, it was very clear that asking charities to be more charitable, to give volunteer days, was just not appropriate at all. So I think it's really driven this divide between what is market purchasing when your core purpose is to manufacture goods or services to make a profit. And then you can also do good for society when you bid on a public contract. That's one process. And then there's the other process, which I'm now recommending we call system stewardship. How do we best work with non-market actors, with the third sector, and with the communities that are working with those facing the most disadvantage to get better outcomes? So those are some of the key things that came out of my research in Manchester. What came out of my research in Canada and was amplified and endorsed in Manchester was you can't do the work without talking to the VCSEs. The VCSEs are your best source of knowledge and intelligence. And three things will come up all the time. And so I now define them as universal. The first is a lack of self-esteem. So it's very important that when we're recruiting people, we recruit in cohorts. We consider how uncomfortable it might be for somebody to be dropped into a very unfamiliar environment when we're trying to overcome barriers to employment. So having support from social enterprises, providing gentle employment opportunities to bring people back into work, which is currently so topical with this government, but also overcoming barriers to childcare and overcoming barriers to transportation. Not everybody has got a car in the drive or a husband or a wife that can share the childcare responsibilities. And so when we're designing public contracts, let's think about, are we designing out barriers to employment? Are we making them inclusive? Or are we requiring people to, have their own vehicle, be at work at 8 o'clock? Very hard to be at 8 o'clock in the morning if you have a child to get to school and you have to get to work on public transport. So family flexible work and a month's notice of your part-time contract, incredibly helpful things that we could be building into our systems and making sure that the public procurement spend, which is enormous, is not causing us more problems than we already have, but is actually helping us overcome these societal challenges.
Yeah, no, well, thank you, Sandra. That's highly relevant to a lot of the discussions at the moment about trying to support people back into work. So I hope we can get some of those messages into the places where people are really thinking about that, because that's super important. I'd like to come back to you, Julian, now, around this idea of procurement to partnership. And obviously we have done a lot of work on this in E3M, and we've got the kind of procurement to partnership to toolkit on the E3M website. But it's easy to say it, but how easy is it actually for people to do?
Thank you. Yes. Well, it's very hard indeed, of course. And it's very hard indeed because it's such a fundamental transformation. And it's such a fundamental transformation because it's really an era change in the way things are thought about. So what we're really talking about here, when we're focusing on, we start with the focus on procurement. We say the procurement of public services is really about commissioning of public services, and it's not just about procurement, and commissioning is different to procurement, and procurement is part of commissioning, but not the only part. It's service contracts, and you can have subsidy grants, you can have approaches to various approaches to investment, you can have various approaches to facilitation and support of public services, a whole range of different things that aren't about procurement at all. It's mindset change also in a broader sense, because the reason procurement is so dominant in public services is because we've been living with neoliberal economics for 40 years. The procurement is dominant in public services because the market theory tells us that the most efficient way of doing everything, including procuring services, including procuring, buying public services, the most efficient way of doing something is to buy in commercially competitive markets. And it's pretty clear, our experience, our contemporary experience, is that just is not true in a whole range of ways, but it's certainly not true in public services. Now, some people might say, well, the competition is an appropriate approach in relation to public services, but it's very clear that in some, at least, areas of public service, and I would say most areas of human public services, the market has shown itself to be a deficient mechanism, and it's even been pretty observable that those public services are not really subject to markets at all in a meaningful sense. Take two examples. Take the example of the small community expert charity delivering services supporting women and girls against violence. Now, those are typically small community charities. They're typically dedicated to their role, whatever funding and whatever engagement they have with the public sector. They're ideally suited to providing those services in relation to the statutory obligations that the local authorities have too. The statutory guidance in relation to domestic abuse says exactly that. It says it describes that type of provider, and it then goes on to say, and that type of provider really should be supported by grants. So the statutory guidance is saying that type of provider should be provided with grants, and the organisations that represent charities in that sector are completely exasperated by all their members being put through full commercial tender processes when that's totally unnecessary, totally impractical, and totally disproportionate. There's one example. Another example is a very high-profile example, children's residential care, and there are similar issues in relation to special educational needs, where the commercial providers, the commercial suppliers have dominated the market, and the market has become distorted to the point of becoming monopolistic, where that leads to service provision being very inappropriate for young people, being sent to areas way out of their own neighbourhoods and localities at extortionate pricing, where providers, well-publicised matters of providers, suppliers receiving excessive profits or demanding excessive profits, and also acting in ways that minimise cost to deliver those profits. Dysfunctionality in commercial markets delivering public services. So there's the huge need. Of course, transformation from these situations, transformation from an era-defining focus on markets as being the only thing is a massive issue to transform. And another way of describing this is that really it's quite a simple thing to put out a tender to buy services that you assume are needed by your general view of the world, as opposed to actually going about the interrogation of need, identifying the need by reference to the individuals who have the need themselves and their carers and their supporters and the expert providers of services within the localities who know them really well. That's a massively complicated exercise, but a very essential one if you're going to deliver essential public services, and even more essential if you're going to deliver public services with inadequate funding. You've got to make sure that the resources are applied in the best way possible and seek to supplement the public sector resources by whatever other community resources are available. It's a really active professional exercise, and one that is typically represented now by a very traditional commercial tender approach. So we're trying to transform that methodology, trying to create methodologies that are much more about collaborative engagement with all the stakeholders, especially the VCSE with their expertise and capability and relationships with the people who actually have the needs. So going back to how hard it is, some examples of that. I mean, E3M, which Jonathan established and I helped establish in 2012, has been talking about this subject for all of that time, and it's obviously been a subject even before that. I really would start my focus on this from the late 1980s, when new public management was coming in and grants were being turned into contracts and charities were being told to professionalize and become commercial providers in effect. And what that led to was the last 40 years or last 35 years of contracts that are completely dysfunctional. They're really, really bad contracts, not serving anyone's interest. They're unfair, they're unbalanced. A contract should be a mutual relationship between two organizations that are trying to achieve the same thing. And then we have the procurement coming in and overlaying dysfunctional contracts with dysfunctional process, because the contracts then became totally prescriptive, no opportunity even to discuss the contracts. So that's one area of dysfunctionality. Then the procurement issues that we've been mainly focusing on as well. So the point there is there's a need to engage with complex human social service environments in complex ways, and accepting there's massive uncertainty, accepting you're not going to solve things overnight, accepting that very, very many things need to change, and you're only really going to be identify some of them at any one time. One of the main examples that I would draw upon in this respect is the book that I co-authored in 2016. It's called The Art of the Possible in Public Procurement. It's co-authored with a very excellent social enterprise, HCT group. And that was all about the extreme frustration that those enterprising, innovative, public benefit providing social enterprises had, initiating ideas, proposing reforms, providing innovation, engaging with the public sector who weren't able to discuss those things properly. They were interested up to a point, but then a guillotine came down, procurement was the issue, and the conversations got killed. And over and over again, this was happening. These really good ideas were not progressing because procurement was supposedly a legal barrier. But procurement was not a legal barrier. It was the application and interpretation of procurement that was a legal barrier. And that's what The Art of the Possible talks about. It talks about the flexibilities within the previous procurement regime, which has just been superseded by the UK regime. Within E3M, there are three groups. There are the progressive providers, there are the progressive commissioners, and there are the progressive social investors. All three groups focused on these issues. We've never had a conversation in all of that time, all of those years, that hasn't really focused in on procurement in one way or another as a problem, even when we weren't talking about procurement particularly. So these are the sorts of areas, these are the massive issues that require change. Another example of this, perhaps the one I'll finish on, is the Innovation Partnership. The Innovation Partnership came in as an explicit potential way of commissioning public services in 2015. It was focused on partnership. It was recognizing that a commissioner might not know exactly what they want to purchase, but they could engage with a partner who would be able to assist in the development of ideas and the co-design of the services. And that's hardly been noticed at all in all of these years. There's one excellent case study, which is on the E3M website, Leicestershire Children's Services Innovation Partnership, which I supported. Liz Perfect is the name who should get full recognition for that. She was the courageous commissioner who took it forward. And that there's an evaluation report of that, which describes how fantastic the relationship is between the public authority and Barnardo's, who are the innovation partner, in the 12-year consultancy relationship, partnership relationship for the redesign of public services in Leicestershire. Now, that sort of example ought to be much more widely known, ought to be replicated. There's a similar case study of Plymouth and the Alliance contract, which we should also talk about. So the answer to the question, Jonathan, hugely difficult, but certainly possible. We have pioneering examples, and we now have some greater flexibility in the new Procurement Act, and especially in the National Procurement Policy Statement and the new focus on social value in the procurement notice.
Thank you, Julian. And I guess with the new Act coming into force and everybody looking and thinking about what they should be doing, it's a great time to actually reflect on what is possible and to try and look at that. And obviously, we're very keen to support people to do that. But I'd like to come back to you now, Sandra. I know that you've joined Stone King to lead on demonstration projects based on a model that you successfully developed in Canada. Can you tell us a bit more about what a demonstration project is?
Sure, and I think this responds very well to something that's just appeared in the chat with a procurement person saying, well, where do we get training for this? How do we do this? How do we work with grants? How do we work with joint ventures? How do we attract social investment? And in our demonstration projects, this is what we're seeing and hearing, is that we've adopted a one-size-fits-all. If the only tool you have is a hammer, everything looks like a nail. And I think of it as like water running downhill. It will take the path of least resistance. And because everybody's busy, we continue to use competitive market purchasing. It's absolutely not fit for purpose for the 75% of local authority contracts that are now being spent on complex adult and children's services. So the demonstration projects in Canada that I led in Canada were exactly that. They were me and a team working alongside commissioners to support commissioners and procurement staff and an internal organization to build the capacity to maximize the flexibilities and to challenge those organizational mindsets that get so stuck. And so is working with Stone King, we convene demonstration projects. They require 4 actors to come together. You need Stone King, and you need us to bring the legal expertise, the knowledge of what innovations are happening in other areas, what's possible, the art of the possible in collaborative commissioning. You need a willing and bold commissioner, a contracting authority that truly wants to maximize the flexibilities under current law. So I'd just like to stress that everything we do is compliant with the regulations. It was 20 years ago, it still is. So we absolutely are now, we have stronger, more enabling regulation than we've ever had, but it has always been possible to work in this way. It's just not usual. So this is the big myth of procurement as to what we believe is possible and what is actually possible is very, very different. So you need Stone King convening, you need a contracting authority, you need the knowledge expertise of the voluntary community sector. So you really need to place the VCSE knowledge at the center of your system intelligence, interrogate what matters most to the clients that you're trying to work with, to the people whose lives you're trying to change. It might be homelessness, might be mental health. And then we look to bring in a social investor in a national foundation, because doing things for the first time, we know is going to take longer. So the model works on a match funding partnership between a funding partner, a social investor, and a contracting authority, using the knowledge of the voluntary sector and the knowledge of Stone King, Julian Blake, and myself, supporting people in real time. So in the real world, which is frankly what I found a little frustrating about academia, is that I wasn't rolling my sleeves up and getting to work as a practitioner, where I'm much more comfortable. So that's the work that we're doing. Lydia has asked in the Q&A if I can foresee PPN02, the social value model, rolling out to apply to local authorities. And there is absolutely nothing stopping local authorities from using the social value model, which is free of charge, which actually requires the local authority, or in this case, it requires central government, but it could be applied to local authorities equally, to interrogate what good looks like. So you actually know where you're going and what you're trying to achieve. You understand your community, you understand what matters most, and then you value what matters most against 8 very good priority policy outcomes. And those priority policy outcomes, there's nothing on there that I think any socially minded person would disagree with. But I'd just like to have a call out to priority 3B, which requires collaboration, co-design with communities and with anchor partners. So there is a requirement. Now, that is a requirement for central government in scope bodies. But again, this is an excellent model. There is no reason why any public sector body could not apply the exact model that is being used at the central government level, because it also allows for adaptation. So if you need to tweak it a little bit for your local context, there's nothing to stop you tweaking it a little bit. It also requires you to overcome barriers to employment. So, we can be looking at working with social enterprises that are employment supporting social enterprises. And in my work in Canada, I saw charities named in public contracts as a delivery partner. So that you may well have a large commercial actor delivering something that requires a commercial application, but the public authority could work with the local VCSEs and say, we require you to recruit people from our XYZ organization, and how many people will you recruit and support into employment through our partnership with? So the work that we do in demonstration projects absolutely places the knowledge expertise of voluntary community social enterprises at the heart of the system. And then it is a continuous learning approach. What are we learning? What are we doing differently? What would we refine next time in our procurement strategy? So I think we have everything in place. It's just not mandated at the local authority level. But Julian did co-author a really good publication. It's a very practical, easy read, called Purposeful Collaboration. And it is published by the LGA with NCVO and the Lloyds Bank Foundation on how to collaborate, how local governments can collaborate with the VCSE sector, and what are some of these collaborative pathways. One of the things we've already seen in our demonstration, one of the demonstration projects that we're currently leading in South London, actually, is we need more sheltered accommodation, more supported accommodation for people with mental health issues. And a charity came and they said, well, we don't mind. We have money to invest. We will come to the table with a 2 million investment. We can acquire property because we have social landlords exiting the marketplace. And they said, we will stop that going back into the private marketplace. We will protect it for public purpose. We'll just ask for a 5-year contract to deliver the services that you're already asking us to provide on a 1+1. So longer term contracts with trusted providers who've already proven themselves to deliver good outcomes, and a conversation. If you change this behavior in the local authority, we, the voluntary community sector, your public purpose aligned partners, will do this for you. We can do this in your community if you don't put us through a sausage factory procurement process that's not fit for purpose in complex human services. So that's what we're doing demonstration projects.
Thank you, Sandra, and that's very helpful. And I think it really emphasizes, the big issue that we have is around the culture and the way that people interpret the rules, and not really the rules themselves. And where there is some brave leadership and some creative thinking, people really can do things differently. But it's very, very hard because things are so ingrained. So I'd like to see if we can perhaps address a couple of the questions that have come up. I know you've touched a bit on that one around the way that local authorities can really use some of the new guidance that's come out on social value and look at kind of perhaps less mechanistic ways of being able to do things and getting around the issues of just looking at the added social value rather than the inherent social value. Maybe we'll come back to that, but I'd like to ask about grants, because I know that this is something that a couple of people have raised, and I think obviously it was something that back in the day local authorities used to give lots of social organisations grants, and then kind of Julian described the process of public management coming in, and a lot of that kind of disappeared. But grants aren't illegal, are they, Julian? How does it work?
No, grants are a very appropriate way of providing for public services, because what you will be doing is providing funding to excellent organisations in the locality who are already purpose-driven to deliver those services in the best way they possibly can. So you can identify excellent providers already dedicated to the services that are required and support them by providing funding. That's completely outside procurement. In fact, it's regulated by a similar competition law regime, which is the subsidy control regime, which was the old European state aid regime. And in relation to public services, there's virtually no limitation to how you subsidise. Rather like the light touch regime under the procurement regime, there are exceptions within the subsidy control regime, which basically say there are good grants that are publicly beneficial and they're legitimate, and the subsidy control regime doesn't have any more to say about them, quite apart from the fact that not all grants are into competitive markets. Again, similar to the procurement regime, when a grant is not into a competitive market, it's not a regulated grant, it's just a legitimate grant that is within the general scope of public authority discretion. So the real point there is it's one of the legitimate, appropriate ways of commissioning, stewarding public services. It ought to be much more common than it is. It ought especially to recognise the essential role played by small community, expert, niche, dedicated charities. They need their funding to provide their invaluable contribution to the social economy, and public funding coming through grants would be the most obvious way of securing that funding, although again acknowledging that the whole funding of public services is problematic. Nevertheless, grant funding excellent organisations already doing excellent work is probably increasingly available resource, leveraging the public sector funding.
Thank you. And we also had a question with a kind of particular sort of request for some advice around health and social care procurement. Are there any kind of things that you'd like to bring up around that?
Yes, I saw that. I think that probably links to the point Sandra answered on how local authorities can apply the National Procurement Policy Statement and the Social Value Notice. It's similar in relation to the provider selection regime, the NHS provider selection regime. Because what I would say about all of those things is you don't actually need any of this written down to do it. And so the whole problem with procurement has been the idea that it somehow stops good things happening. So the need there is to say, well, what's the purpose? What's the purpose of the regulation? The purpose of the regulation is to secure best value public services. So the regulation is not going to stop us doing that. We just maybe need to be quite clever and applied and intelligent about how we do it. But it isn't getting blocked off by the regulation. The regulations might not be might not be quite so obvious how we pursue them, like it isn't very easy to find the light touch regime in the existing procurement regulations, but it's there and it's completely facilitative. And in a way, the question's more focused perhaps on the very difficult issue of integration between health and social care, the different regimes that apply, the different funding regimes that apply. But again, nothing can actually stop that integration happening in appropriate ways. It's just that it requires a lot of dedicated effort to find the appropriate pathways, to create the appropriate models, which is really the biggest subject for me in all of this. That we know very well what the competitive approaches are. They're very dominant. We don't know very well what the collaborative approaches are. There are pioneering examples of innovation partnerships, alliance contracts, community development projects, other forms of collaboration. They need to be systemized. So the pathways and the models for these collaborative methodologies need to be developed, replicated, disseminated, and systemized. Then everyone involved in public services will have a clear picture of all the available methodologies and won't be forced down a channel which suggests the marketized, commercialized procurement route is the only one.
Thank you. And earlier, Julian, you and Sandra, you both kind of mentioned a couple of examples that have, brought things to light. But I wonder if you could give just a couple more examples of what you see as really excellent collaborative commissioning, where you've seen something that's been really transformative.
Julian's got lots, I know, but we also have a book full of them. So Vitalizing Purpose, I have a chapter that I wrote on priceless procurement and on some of my experiences in Canada. Julian has a chapter in that book it's a very easy read, but I think there's 18 chapters of really good practical examples from around the UK with my own Canadian one chapter in there. That's a really good place to access practical ideas and to see what's possible. The demonstration projects, the reason we think that it's a good way to change behavior is we'll work with the same rules. So when people read these case studies, and we will be doing the demonstration projects under the new Procurement Act 2023, we'll be looking at, when does the Procurement Act not apply? When are we actually not in procurement at all? Because I think more and more local authorities are interested in how they attract social investment. How do we collaborate? And so when we bring those examples together, we will then be publishing more and more of them and speaking about them at conferences so that we can inspire people to say, well, if they did that, surely we can do that. But many, many examples exist. And I'm going to put this on you, Jonathan, because I think you have one from the Northeast that you could.
Well, yeah, I mean, I think one of the things that really strikes me, there's another kind of element that we haven't had time to go into a lot of detail about today, but the role of social investment and how that can, working with a really open-minded public authority and a great public benefit provider, can make the difference to things happening. And so one of the examples actually that we do mention in the book, which incidentally you've got the link in the chat for, and it's free to download onto an e-reader from the E3M website, so you don't need to buy it. Somebody was asking about free advice. Well, there's something that's free, and there's a lot of information and resources on both the E3M website and Stone King websites. But that's the example of something that came out of one of our E3M Alchemy events that we did with West Lindsey District Council in Lincolnshire, where there was a part of the town that was very run down with very poorly maintained, privately owned social housing. And we were looking at ideas and solutions that could come up with that. And it's resulted in a social enterprise called P3, working in a 10-year partnership with the local authority. P3 were able to raise £4 million in social investment to be able to start buying up those privately owned houses and turning them into proper social housing, really helping to kind of transform the lives of people in that area. And so that's a great example, but there are lots of others where social investment can come in and help unlock things. So I don't know if you'd like to add anything to that, Julian.
I would like to add an inspiring example, which isn't in the UK, it's in France, of a mature social enterprise, which is described as an Anglo-Saxon style social enterprise. It's called Group SOS. It started working about 35 years ago, I think, as a new organization, and their avowed intent was to undertake public service projects that improved the lives of individuals, improved the social outcomes, and saved money at the same time, which is often the concern of the understandable concern of commissioning authorities. That organization has been so successful that 40 years later, it's turning over, it's a network turning over £1 billion, all projects based on that same methodology, improving lives, improving social outcomes, and saving money at the same time. Now, of course, that is very logical. If you're going to commission public services well, you're going to get into more preventative approaches, and you're going to reduce the overall cost to the public purse of managing public services.
Thank you, Julian. I can see we had another question in the chat, which I want to kind of put to you, Sandra, which was around this, which I think is really how you involve the sort of co-production question, I think, about young people being equipped with the skills required to engage in public consultation as they enter the labour market, and to what extent, where do they sit? Is it with council economic development departments? How would you respond to that, Sandra?
I think it's really crucial. I've actually got lots of young people around me now who, many of them highly educated, who can't get into the labour market. So I think we've got a real problem with pathways into the labour market. And I think any design labs are what I run. I facilitate design labs, and you bring people together to talk, and you always make sure you've got unusual actors in the room. And the theory behind this actually goes back 200 years to the invention of the weekend in Manchester, where a Salford lecturer was convening, and he realized that women didn't have a voice. So he invited women into the equation, and they had a discussion about what would improve their lives. And they said, well, having a family day. So, that was the beginning 200 years ago of the weekend. And I think sometimes we've become so marketized that we've lost the idea of the public value, public purpose ethos. And this is what I'm just going to repeat again, because we are getting very close to time here. I'm going to repeat how important it is to distinguish, when are we market purchasing? And when is it a commercial entity for profit? And when are we when are we stewarding a system? So I see a comment here about the children's homes as well that I just want to touch on. Let's not be calling our most vulnerable children entering foster care and residential children's homes a child placement market. Let's call that kind of language out. Let's jump on it very, very quickly. And, a business case, we need a public value case. So I would say, takeaway for today for procurement people is to really think on the demand side. Am I just allowing this to be following water downhill, following practice I've done for 20 odd years? Or do I need to stop and distinguish market purchasing from system stewardship? And what are my options for system stewardship? Read the books. And if you need it, get in touch. Give us a call.
Fantastic. That's your big takeaway. And Julian, what's your takeaway from today?
Mine is that a book by Professor Paul Collier called Left Behind says that the UK embraced the market theory generally more dogmatically than any other place in the country. And he suggests that what we really need to do, and this is absolutely applicable to public services, is, and here I'm quoting, instead of single discipline models that give precise answers that are badly wrong, we need integrated models that confess to imprecision but are roughly right. Now it seems to me, a way of iteratively acting to improve the whole situation that we're discussing.
Well, thank you hugely, both to you, Julian, and to Sandra, for your kind of excellent input today. I would like to thank everybody who's joined us online. We would really love to get your feedback, so please do. You've got the link in the chat. We will be getting in touch to let you know when the recording is ready, and please do kind of share that and look at the E3M website and the Stone King website. We'll have kind of lots of follow-up information, and we're always really keen to work with people to really support proper transformation in public services that can improve people's lives. So thank you very much for spending time being with us today.